Hello, my name's Gerard Ingham. I'm one of the directors of Springs Medical, and with me is Dr. Albert If, one of our senior doctors. Albert, today we hear the news that Victoria is going into a lockdown from Tuesday with schools closing and all non-essential services closing. What do you think of that news?
I think it's a very good news, Gerard, because I think it's important that people realise that if we actually have this spatial distancing, we'll break the chain and we decrease the transmission rate from hundreds to down to single fingers. So it's important to actually get this happening, and within 2 weeks we will actually be able to clear a lot of people.
Great, and that's really good to hear, given that we're hearing that we have had a case in our community, so it's important that we do that.
What's happening at Springs, Gerard?
Well, at Springs you'll notice that we are still opening despite the lockdown, because we are of course an essential service. But you will notice some differences. I mean, we've already introduced today at our first ever flu clinic, we had every patient who came in, they were greeted at the door and given some hand sanitizer to use, and they were asked questions about whether they had recently been travelling or whether they had any respiratory symptoms such as a cough or cold or sore throat or runny nose. And because we really don't want anyone who might put the whole opening of the surgery at risk and our staff at risk entering the building without us wearing appropriate protective equipment. So those questions were being asked at the door. That's the first thing you notice. The second thing you'll notice, if you look for an appointment, you will be often offered a telephone appointment, because we're finding we can deal with a large amount of problems can be dealt with over the phone, particularly those routine prescriptions and routine reviews that you needed. It's really the time when we'll try to put off as much face-to-face contact as we can. If we do need to see people face-to-face, you'll find that when you come in, the chairs are all separated and you'll be kept
At the appropriate social distance.
1.5 metres, and you'll probably notice that there's not much waiting going on at the moment. The patients are in and out quite quickly. Another thing we're doing is, if we do have patients who've got respiratory symptoms like a cough or cold or runny nose or a fever, we're tending to see them only at one particular time of the day and going in through a separate entrance. Again, just trying to make sure that we're keeping anyone who might be unwell with COVID-19 separate from the rest of the community, because that's what this is all about. It's about keeping everyone separate.
It's important to do that because it protects our staff just as much as you. We have isolation rooms to do this as well, so those areas are designated, and the rest of the patients will be kept away from that. Great.
And so look, people have been telling us that they've been really appreciating us making these videos available through YouTube and through Facebook. So please keep watching, keep for updates. We'll be able to update you through this when we're next able to run a flu clinic, and also when the pneumonia vaccines are in. Unfortunately, they've run out as well. So that's goodbye from you and goodbye from me then.
It's goodbye from him. Remember to be kind to each other.